Hi, everyone. Thanks for joining us today on TIP International Radio. I'm your host, Leah Maston. We are showcasing prestigious top professionals from all industries all over the globe to share their experiences and stories of success. We have a very special guest joining us today who is a world-renowned top oncologist and hematologist affiliated with Duke University Medical Center and Thomas Jefferson University. This amazing woman is an in-demand physician, widely known for her passion in healthcare, and is also an author, teacher, and lecturer. She was just recently honored at the International Association of Top Professionals IAOTP Annual Awards Gala at the Bellagio Hotel for her selection as Doctor of the Decade and Empowered Woman of the Year Award. Everyone, please welcome Dr. Susan Littman. Hi, Dr. Littman. Thanks for joining us today.
Thanks, Leah. Thank you for having me.
Well, we are honored having you on the show. Dr. Littman, you have dedicated over 30 years of your life in healthcare, hematology, and oncology. Tell me, what first got you started in this industry? Did you always want to become a doctor?
I didn't always want to be a doctor. I thought I started off my career in college thinking I wanted to spend time studying the natural environment, the plants, the animals, because I had always spent a lot of time growing up outside, camping, canoeing, doing things like that. But then in college, I spent some time like being involved in organizations that were involved in helping students to do better and helping with student life. And then towards the end of my college career, my brother developed a serious medical illness, which brought me home. And then shortly after that, again, my sister developed a similar medical illness. And those two back-to-back personal experiences with cancer ended up changing my whole focus in life and maybe really want to go into medicine. And that's how it happened.
I could see how a personal experience like that would really have an impact on the trajectory of your career.
It really did. I felt like I was changed forever, both by experiencing that at such a young age and also having to interact with my parents who were really just devastated at the time. So I started off just going to the medical library in town, at the medical school in town, and then did the requirements and got all the testing done and applied to medical school. And fortunately, it worked out. I got in and life went from there.
The rest is history.
Yes, exactly.
So in addition to being a doctor, you're also a sought-after lecturer, author, and teacher. Tell me about your experience with that and what are some of the topics that you shared with the world?
Yeah, I think just having a personal experience with childhood cancer, well, sort of like childhood cancer, I always have been interested in genetic predisposition to illness. So I personally feel like that your genetic background or understanding genetic predisposition to illness is really important in medicine. It not only affects, oncological processes, but it also is important in, fighting off infection. For example, nowadays with the pandemic, there's very different responses to infection with COVID-19. Some people get very, very ill, have this respiratory illness, are sick and die, or have, illness associated with the virus, even after the virus has cleared from their system. And other people, seem to fight it off very well. And these sorts of differences in our bodies I think are really important, both for how we deal with illness, but it's also important on the flip side in thinking about therapeutics. So I really think that those are important issues. The other issue I think is important that I've gotten involved with more recently, doing more geriatric medicine and primary care, is access to healthcare. And this is very important because there are differences, because we don't have a uniform health system. Everybody has to acquire health insurance differently, and not everybody has the same health care insurance, and so equal access to healthcare now is important in terms of just equity issues in the United States. I think that's going to be one of the newer issues that we're having to deal with in this country.
Absolutely. And I'm sure with COVID happening right now, it's been exacerbated. I mean, you're really seeing a lot more of it.
Exactly. I mean, it's fortunate that the vaccines are being provided free of charge, but there certainly are differences in access to healthcare, ability to get into the hospital, also educational differences in when to go to the emergency room and seek attention. So it would be nice if all of those things could be equalized over the next couple of years, with more open-minded approaches to healthcare.
Absolutely.
And insurance.
Yeah. Hand.
All of those things are important. And because that's the crux of the unhappiness of people. You know, it has a lot to do with inequality, but even the people that are like perpetuating the inequality has to do with educational problems, and not really understanding that others aren't really out to do any harm to them, that they really need to have more acceptance of others in the world. So I think that those issues of equality can possibly, who knows, can possibly be solved by education at a young age, where you started off in a very young age, so that when you become an adult, you're going to be more open-minded. You're going to be more able to take in new information, like wearing masks and, social distancing and possibility of a new vaccine you hadn't heard about before. And also that you're not going to always be parroting things. If you came from a prejudiced environment, you're not going to be parroting things that are hurtful to others in your society. Even as new things come up in the world, like, widespread acceptance of gay marriage and things like that, where, maybe that wasn't exactly the way it was when you grew up. I mean, it is for the younger people now, but
right.
you can have enough skills that you can be able to contemplate new information, synthesize it through, and act upon it in a way that doesn't harm other people, But I do think that inequality in terms of education and healthcare really impact upon our society. We're seeing it at its worst place right now, and that's why we really need to change things around. Because even other countries aren't, well, I don't know, but I think other countries don't seem to be so at each other like our country is. And that's because we don't have these freedoms. There are too many people that are not well educated, and too many people that are fighting just for regular old medicines, like simple things that we should have in a first world country.
Absolutely.
I hope, I just hope that those problems get solved over our lifetime. And, I'd like to work on that some way. I think either through, I don't know whether you have to work through government or a nonprofit, or just providing educational materials out there in some way. I don't know the exact method that you should do that in.
You have over 3 decades of professional experience as a medical oncologist and hematologist. So what would be some advice that you would give to somebody starting out in your industry?
Okay, I like that question. I think the thing that I would say is that everybody comes from different backgrounds. You can go into medicine from almost really any background. You just have to get the requisites to apply, take the MCATs, but it all requires, in order to get into medicine, a lot of dedication and hard work in order to pursue your dedicated, what you feel is your mission in life. And I think the main thing is to have that focus in order to be able to pursue your options in order to get into medical school. And then after that, you just really have to work hard. You have some delayed gratification because there's many years that you're in training, but in the end, then things blossom out in terms of being able to do a whole lot of different things that suit your personality and your skill set and your long-term goals. There's so much in medicine. You can do so many different things, and that's the beauty of it.
Hard work and focus is great advice. Throughout your illustrious career, you have won numerous awards, honors, and featured in magazines worldwide. This past year, you just recently graced the front cover of Tip magazine and were on the famous Reuters building in Times Square. You will also be honored at the New York City Plaza Hotel in December to be inducted into the IAOTP Hall of Fame and to receive the Top Oncologist of the Year award. Congratulations.
Thank you.
You're welcome. What would you say has been the highlight of your career or one of the most memorable experiences that you've had to date?
Okay. Well, I have to say that this interaction and association with IAOTP has been absolutely fantastic. I love Stephanie Sarami and sort of her vision to bring a lot of people with a lot of different in a lot of different professions together, for interacting with each other, socializing and learning from each other. I think that's absolutely a fantastic idea and allows people not to get into, cordoned off, when you're opened up to various ideas from different walks of life and different professions. In my own career, I was very lucky to have trained at, a lot of really good places. Where I did my residency, there was so many smart people that had really gave me good grounding in how to think about medicine, inspiring to be as good as they were. And I feel like that set me off on a really good place. And then in fellowship, I was lucky enough to work in the lab with somebody who was also equally as competent and skilled. And his name is Paul Modrich, and he ended up winning the Nobel Prize in biochemistry a few years ago. So I feel like between the clinical science and the basic science and this really set me to be able to focus on the important issues in medicine. And since then, I've taken all of those things to heart to try to really be as good as I can. And now I'm at a different place where I can share that with others.
Definitely. And I bet being able to care for patients and have that relationship and impact is enriching and rewarding in itself.
Yeah, and it's wonderful. One thing I didn't say is that there's something very special about the doctor-patient relationship. When you are in a room with just patient and their family, and trying to help them to understand the situation that they're in, explain everything. And I really love that part where you teach them, what's going on, what's the appropriate treatment, how to make the right decisions to help themselves and guide them so that they can make the right decisions. And it's depending upon whether you're in dealing with a life-threatening illness or you're dealing with end-of-life issues and how to live the end of your life gracefully. They're really like, it's very rewarding to be able to help people through those difficult times. Yeah, and part of life. It's I feel like it's a gift that you have as a physician to assist in that way.
Yeah, you play a very important role for people in that space going through that. That's very special. When not working, I know that you have some hobbies. What do you like to do for fun?
Well, of course, I like to get out in the outdoors, hiking, canoeing, enjoying the natural world. I love gardening, sort of an extension of that, only in a smaller fashion, more. There's an artistic component and a relaxing component to gardening. I know why more people don't like it, but I really do. I also like exercise.
You have your Zen garden.
Yes. A couple of years ago, I was in Japan, and it was more than a couple of years ago. It was part of my. I did a rotation there, and they have these all over the place, like in every little corner, doorway, whatever. And I think that those are just the beauty of them is very relaxing. Definitely. But nowadays, more utilize those yoga techniques of relaxation and meditation, and also, sort of from the same gist of life, but not exactly the same, but different religions have different ways of helping you to relax.
Definitely.
So,
and something some people may not know about you is that you used to be an ice skater.
I did. Yes. I spent my younger years in the ice rink, practicing, and then there was a whole series of tests that we took, and then we had competitions and we had shows, and that's really wonderful too. I really enjoyed it.
What a fun show.
Fun part is that, we wear these little outfits, and I really enjoyed designing the outfits and sewing them back in the day when you had more time.
Yeah. This just takes a little bit of time to all that intricate detail to.
It's I keep on saying I'm going to try to get back to some of those simple things. So far, I don't have the time, but maybe someday I will when I retire.
Yeah. When looking back, what would you say that you attribute your success to?
Yeah, I think once you decide what you want to do, that you really focus and single-mindedly achieve what you want to, what your goal is, and secondly, to not get waylaid by things that don't go perfectly, because there's always someone or something or that will get in your way, and that can kind of get you down or make you lose focus, and you really have to be able to let that go. Don't let the turkeys get you down, as they say.
Yeah.
And be able to contemplate where you are and reorganize and continue onward. That's really important. I mean, not everybody does it well, and sometimes we have to learn through some experiences that don't go so well, but that's ultimately what you have to do.
Well, your career speaks to that and your success. So well, I just want to thank you so much for joining us today. We are so very honored to have you as a guest.
Thank you. It's just been a really lovely experience, and I'm really happy that you do this to help communicate and to interact and to share one's life with others. It's nice.
Well, again, I hope I get to see you at the gala in December.
Yeah, me too. That would be really terrific. And they all of those events are so nice. I mean, everyone I've gone to, I meet a different group of people who are just as the last ones. Yeah,
absolutely. And it's always growing. There's always new people being added, and so they're always super, a lot of fun.
Yeah. Okay.
All right. Well, have a wonderful rest of your week, and I will talk to you and hopefully see you soon.
Okay, thanks.
Okay, bye, Susan. Bye.
Bye.
And please, for more information on Dr. Littman, you can visit her page on www.iaotp.com website.